So you or maybe your child has ADHD and you want to try treatment without medication first. Well, here's what I think about that as a therapist for ADHD. So in my work, I take what I call a medication neutral approach when it comes to therapy, meaning unless you are like a danger to yourself, danger to others, maybe you're having like very severe hallucination symptoms, things like that, right? Psychosis, things like that are going to require medication in order for them to be alleviated. I am not going to make you take medication. In fact, in most cases, unless you have a guardianship or there's some weird circumstance, I can't make you take medication anyway. I'm not the prescriber of medication. Medication's not in my scope of practice. I may repeatedly suggest you might want to go to the doctor and, we might want to get something checked out and make sure that medication may be appropriate for you at this time, right? There's going to be times I know where it's like, I know you need medication, but I can't say that out loud because, licensing and scope of practice, but I've been doing this long enough to where I would know, right? But most of the time, you don't necessarily need or not need medication. In fact, it's more of like, how much of this do you want to ultimately benefit yourself, right? So medication most of the time for ADHD is going to alleviate the symptoms. There are going to be times for some people who are going to have very adverse reactions to those medications. And for a lot of people, if you're a first-time medication user, you don't know what's going to quite happen. And so a lot of people will want to come to therapy and they'll say, I want to work on my ADHD skills, but I don't want to take medication. That is totally fine. The approach I usually take with this is, okay, let's try working together for the next 2, 3, 4 months or so, right? Let's see if we can get some skills built. Let's see if we can get some routines built. And if you feel good after that, then great. We might even be able to end our work. But if you still feel good after that, you feel like something's going in a positive direction, then we can just put medication on the back burner for right now. If things are getting worse or nothing's changing, then maybe we want to explore the idea of you talking to a doctor to get a medication evaluation to see if it would be helpful and useful to try at this point. But it allows the person or the parent to decide what they want to do on their time rather than feel like they're being forced into medication. And using this approach, there's been quite a few people who I've worked with, they haven't had to get medication and they felt that their symptoms were good or even great at times. And it's just one of those things I don't like about online culture when it comes to ADHD is there's this big push now to where you absolutely should be on medication, which I think like 5 or 10 years ago even, it was the exact opposite. It was very much never put your kids on medication, never put yourself on medication, anti-big pharma, all that kind of stuff. We kind of went from one extreme to the other because in the ADHD community, if you say you're not taking medication, people will be upset by that because they look at that as a direct attack on themselves. And so my whole philosophy of being medication neutral is do what's best for you, do what's best for your health, do what's best for your journey. And ultimately, if you have hesitation about it, as long as, someone's not going to drop dead, why do we need to rush into really anything? Yes, you should seek professional help. Yes, you should rely on experts to kind of tell you, hey, here's how this kind of works or what have you, right? But at the same time, you are the expert of your own life. If you're not ready to take medication, if you're not ready to try therapy, if you're not ready to do certain things, then you're just not ready, and there's no use in me trying to force you either way. It's going to be really up to you at the end of the day.